diseases like diarrhea or jaundice or this, it is cancer never occurs in a day. It takes a longer time to adapt. A tissue in the intestine has to modify itself, slowly it develops, then cancer goes. Sometimes it may years, sometimes it may be months. So most of the cancers goes in stages. And the mucosal stages, that is inside the mucosal only, it is case stage 1, then stage 2. When it spreads outside, then it goes stage 3. When it spreads into the body, then we call stage 4, like stages. And most of the time patient comes to us, patient can be in any stage, because when they present long time having problem come with maybe stage 4, stage 3. So 20, 30, 40 years before, when we did not have a good scanning system, good investigations, and those time people used diagnosed very late stage. We operated all of them late cancer, majority of them, that's why the result was unsuccessful those days. Now technology has gone, we even in remote villages we have a good ultrasound, endoscopy, CT scan, now we have MRI, PET scan, so many investigation facilities, and we are able to diagnose cancer in more early stages more often. And early cancers are, majority of them are completely removed and it is curable. And late stage always it is this. Those are the people we submit them for chemo radiation, then we operate. And still people think cancer means it's a chemotherapy, radiation has to be given. Okay, if a chemo radiation given, the hair will fall, they become darker, thin, they can't eat well. That is a kind of impression people have. It is not so. And now people are taking diet by which cancer can be diagnosed early. Early cancers completely removed, and surgery is the primary treatment for any gastrointestinal cancer. Even not only gastrointestinal system, also cancers of the kidney, cancer of the uterus, and food pipe and the lung, all are surgical cancer. So early cancers, surgery is a primary treatment. If we do early treatment for these cancers, it is almost all are curable. Late cancer is unfortunate, we have to give a chemo radiation. It is only a palliative treatment. Palliative in sense, it's not a curative. That's why many of them have got a problem suffering with vomiting and losing weight or this. So sensible people always go for getting testing and getting early surgery, they can get cure. So today, those days open surgery, people has to stay in the hospital 2 weeks, 3 weeks, and that incision is very big in the abdomen incision, so they may get infection or wound related problems like hernia, pain, all will be high, they can't resume routine work early. Now the keyhole laparoscopic surgery, we operate through keyholes and we completely remove the tumors, so the recovery time is so fast and they can resume routine work and work as food also they can take normally, and immune status is preserved, so that recurrence also prevented. So I think today, if last 2 months back I was in Madrid, Spain. I was invited to perform a gastric cancer operation during an international workshop. Where I did a cancer operation, patient got admitted at 2 o'clock and the patient was moved to the theatre by 3:30. I started my surgery 4, 6:30 my surgery over, and the patient got discharged even before 72 hours with a normal diet went home. The same cancer stomach, when in 90, when I did open surgery, it took 12 days patient to stay in the hospital and 2 months to resume the routine work, because they have to do strenuous work. Once you cut intestine, wound may heal, but strength can't regain. So that is the advantage of a keyhole laparoscopic cancer operation, so their recovery. So time, some cancers may be 3 days, 4 days, some cancers still like pancreatic cancer may be 1 week, and most of the cancers, time has come down compared to open, very low level, very acceptable level.